One thing that's interesting to me about marijuana is I think people have a really hard time coming to their own conclusion about the negative effects it has. I think it's actually been easier for me with things like alcohol or opiates. The patient will already have insight into like their substance and how it may be negatively affecting them. They're like, yeah, like when I drink a lot and I end up in the hospital or I'm vomiting on myself, like marijuana, it's so delayed. When people have like rebound anxiety 18 hours afterwards, they may not be associating that with the negative effects of weed. It's tricky because a lot of the effects of weed are alleviating negative symptoms in the moment rather than just like the introduction of euphoria. And so I find like when I ask people what it does for them, they almost have no idea that has negative effects. They think it only has positive effects.
How, if I was your patient and I said, I don't actually know, like I like using it, but like I want to know what are the risks of it because I actually don't know. And I'm coming to you as my doctor to ask.
Try to do as unbiased as I can, but obviously I have my own biases when I'm discussing this. I'll say that it's reasonable to want to make your anxiety go away because who wants to experience anxious feelings? And I think we kind of like everyone in the room agrees with that. It is true that in the moment, marijuana can take away your anxiety. And that's probably something you've experienced. So we kind of agree on like another fact. And then kind of what I'll bring up is that using marijuana can be like quenching thirst with poison or like quenching thirst with vodka, essentially. And I think for a lot of my patients, that analogy has stuck well because they do realize like, yeah, it does feel good in the moment, but then it can make you more anxious afterwards.
Yeah.
So you can be kind of like stuck on this cycle.